Everyone, welcome or welcome back to Sowkya Med Vision. Today in this lecture we are going to cover mammary gland. In the previous class we have completed muscles of pectoral region and the fascia, clavipectoral fascia of the pectoral region. Today we are going to cover location, shape, structure of the mammary gland. As it is a big topic, we are going to divide it into two parts. Is part 1 and part 2. Let's see the morphology of the breast. Yes, breast, it is also known as mammary gland. It is presented superficially in the pectoral region. Yes, it is a modified apocrine sweat gland. It is a modified apocrine sweat gland. Yes, it is presented in both male and female, but it is very profound in female. If it is enlarged in males, that condition is known as gynecomastia. Yes, if the breast enlarged in males, it is known as gynecomastia. In females, the breast is an accessory sex organ in the female reproductive system and provides milk for a newborn baby. Yes, useful for nourishment of the infant. And now let's see the location, shape and the extent of the breast. It is in the superficial fascia. It is presented in the superficial fascia of the pectoral region. Yes, it is extended superolaterally. Yes, this is the superior and laterally. Extended as a tail, known as axillary tail of Spence or breast. Yes, this is the axillary tail of Spence. It pierces the deep fascia. It pierces the deep fascia and extended into axilla. It pierces the deep fascia and extended into axilla through an aperture known as foramen of the langur. Yes, the axillary tail of Spence enter into axilla through an aperture known as foramen of langur. Yes, it is hemispherical in shape. It is hemispherical in shape, extended vertically from second to the sixth rib and horizontally lateral border of sternum near the mid-axillary line. Yes, see, this is the second rib and this is the sixth rib. It is extended vertically from second rib to sixth rib and it is extended at lateral border of the sternum to the mid-axillary line. And now let's see the relations of breast. As it is related to pectoral fascia. Yes, it is related to pectoral fascia. See, this green color line is the pectoral fascia and this is the breast. So, this pectoral fascia is separated from breast by a retromammary space. This is the space present between the pectoral fascia and the breast mammary gland. Yes, and it is also related to three main muscles: pectoralis major, serratus anterior and the external oblique. We have dealt about pectoralis major and the serratus anterior in the previous class. This external oblique is an abdominal muscle involved in the formation of anterior abdominal wall. Yes. Now let's see the structures of the breast. There are three main components in the breast: skin, stroma, parenchyma, or it is also known as glandular tissue. Let's see. Skin. The skin, it is a covering of breast, presenting two major parts, the nipple and the areola. These two parts are the pigmented parts. Yes, the nipple, it is a conical projection. The nipple is a conical projection which is presented not in the center but below the center of breast at the level of fourth intercostal space. It is presented at the here. This is the nipple, right? It is presented at the fourth intercostal space and it is richly innervated by sensory nerve endings, making it very sensitive to tactile stimulation, and which is erected during sexual arousal. Yes, and the areola, which is circular pigmented area. Areola is a circular pigmented area surrounding the base of nipple. See, this is the areola. This is the base of nipple. So, areola is presented surrounding the base of nipple. Yes. Now, it containing large number of modified sebaceous gland. What is their function? It is to lubricate the nipple and areola. It doesn't allow areola and nipple to dry and cracken up. It always keeps the nipple and areola lubricates. Yes. Now the color of areola and nipple varies with complexion of the woman. Yes. During pregnancy, the complexion become darker of areola and nipple and the breast become enlarged. Yes, let's see stroma. We have completed skin. Now stroma. Stroma consists of connective tissue and fat. The stroma is majorly containing connective tissue and fat. The connective tissue form the supporting framework. Yes, by forming into fibrous strands known as suspensory ligament of Cooper. The suspensory ligament of Cooper's are the fibrous strands formed by condensation of connective tissue. Yes. Now, it connects the suspensory ligament connects the dermis. Dermis means what? Structure or a fascia or a sheet present below the epidermis, right? It is a layer of skin. Dermis to duct of breast and pectoral fascia. Yes. See, these are the connective tissue bands, fibrous bands, suspensory ligaments. So these connecting ducts to the pectoral fascia and the dermis to the pectoral fascia. And let's see the parenchyma, the glandular tissue or mammary gland proper. So this glandular tissue secretes milk. Yes, the parenchyma, the glandular tissue part containing 15 to 20 lobes. Yes, each lobe containing many lobules divided into lobules which containing cluster of acini. Yes, which containing cluster of acini. See, this is the cluster of acini. Yes, and this each lobe is drained by lactiferous duct. Yes, this is a lactiferous duct. Lactiferous duct is opened into lactiferous sinus before which is opening into nipple. Yes, and this is the morphology of mammary gland. In the part 2 we will discuss the blood supply, lymphatic drainage and the applied anatomy of the breast.